Hi, so Emma and I will be talking about feeding interventions for amyoplasia multiplex congenita. The case study, a little introduction to the case. The case study we were given is a 5-year-old with amyoplasia multiplex congenita, which is also commonly known as AMC. This led her to have a decreased ability to independently engage in ADL tasks such as bathing, toileting, feeding, dressing, and teeth brushing. A little background to AMC. It's a condition in which a joint becomes firmly fixated in a certain position, straight or flexed. This condition occurs prior to birth and it partially or completely restricts the movement of the affected joint. And this can result in a decrease in muscle strength and range of motion, which is what our client was having. It's most common in the hands, wrists, elbows, shoulders, hips, feet, or knees.
Okay, so the ADL that we are looking at is the ADL of feeding, and this is defined in the OTPF as arranging and setting up food or drink, bringing food or drink from the vessel to the mouth, and this can include feeding others or self-feeding. And then the frame of reference that we chose is the HAT model, or the Human Activity Assistive Technology model. And we chose this because the intervention we are using is the SABO mobile arm support, and this could be considered assistive technology. And so the HAT model includes 3 different factors that interact within the context of participation. These factors include human, activity, and assistive technology. The human aspect looks at the emotional, physical, and cognitive elements of a person. The activity aspect looks at the specific activity or occupation that an individual needs to do or wants to do. And then assistive technology looks at the human activity and activity aspects in order to determine which assistive technology is a good fit for the client. And assistive technology can act as an extrinsic device that can support or enable participation in activities and occupations. Okay, so here is our demonstration on our intervention. Hi, Lexi. My name is Emma. I'm going to be your occupational therapist today. And today I wanted to work on feeding a little bit. And to do this, we are going to use this very large contraption over here, which is called a mobile arm support. And what this is going to do is it is going to help support your arm while you're eating so that you don't have to use as much strength to lift the silverware or like a cup up to your mouth, okay? And so before we do this, I want to make sure that we're sitting in a really good position to help support us while we're eating our meal here. So I want to make sure your feet are planted flat on the ground, great, and you're sitting up straight and perfect. You have your arm that you're going to be using sitting on the table. You look good, you're in a great position. I think we're ready to get started. All right. So what we do is your arm is going to sit right in here. So if you want to put your arm in there with your palm facing down, good. I'm going to get this strapped in here. There we go. All right. And then I am going to crank this up, and what that's going to do is as this goes higher, it's going to give your arm some support, and then you're going to feel that you don't have to use as much strength with your arm anymore, okay? And so we're going to start with this a little bit higher for our first time using this, and then as we practice more and more and kind of build up that strength, then we'll be able to use less support with this and have it be a little bit less tension. Okay. Okay, can you feel that starting to really support your arm there? All right. How does that feel right there? Good. Good. Okay, awesome. So we're going to eat some pudding that we have here. And to do this, we are also going to use this piece of adaptive silverware, which you'll just stick your hand in there. It's just going to help you hold on to it a little better, okay? So we'll start out with that. All right, and I want to go ahead and see how you would eat your pudding with this and kind of use a new piece of equipment like this. So you can go ahead and take a few bites of your pudding. Good. Does it feel a little bit easier?
Mm-hmm.
Okay,
Yeah.
great. All right, and now how about we try taking a drink too? I'll give that to you. This handle here is just gonna help you be able to hold on to the cup a little bit better.
Okay.
Good. All right. Does that feel, do you feel like you were able to lift that up to your mouth a bit more?
Mm-hmm.
Like you weren't having to use as much arm strength?
Yeah.
Okay, awesome. And then I did just want to point out too, you could probably see this little blue mat here. This is just called Dysum, and I wanted to use this for the first time that we tried this because since it is a new device and you're learning something new, this just makes sure that our bowl isn't sliding all over the place and it can make it a little bit easier to eat. But I can get your arm out of this here. When we're doing that, we want to make sure that we lower it back down to 1, or else when we take your arm out, this could go flying up and your arm will go with it.
Mm-hmm.
Okay, so should be good there. Get your arm out. Good. Okay, well, that was awesome. It looked like you were able to be pretty independent there with feeding yourself. So I think something like this could be a really good option for you to be able to feed yourself and eat your meals a little more independently.
Yeah, I like it.
Awesome,
Thank
good.
you.
Thank you. Hi, Lexi. My name's Up. Okay, so now we have a video to give instructions on the mobile arm support. Okay, hi everyone. We wanted to make a little video here giving some instructions and explaining how to use this Sabo mobile arm support because I know it's something we may not have all seen before and it's a really cool piece of equipment. So the main thing that this does is that you can place your client's arm right in here. We can have Lexi put her arm in there. And then what you can do is by using this crank here, you can provide tension that's going to give your client assistance and support to be able to lift their arm. So maybe they have decreased strength in their arm or maybe decreased range of motion. It can just help them be able to go through those motions. And so what you do is you crank this lever and it starts at 1 and it goes up to 15. And it's going to give Lexi some assistance to lift her arm here and a lot of support. And eventually it'll get to just be where it's like gravity eliminated. And then you can add more support as needed so that it's like really lifting her arm up. So you can see that as I'm cranking it, her arm is lifting with it. And then when she takes her arm out of this support right here, you just want to make sure that you crank it all the way back down to 1, and you can see the numbers on the side here once you're looking at it a little bit closer. But you want to make sure it goes all the way down to 1, or else when she takes her arm out, this piece is going to go flying up. So just want to make sure that you do that.
And then some additional things to be aware of. There's like a lot of modifications you can make per client. You can get one of these where like it attaches to a table or whatever the client is using, like for our example of feeding. There's a bunch of different sizes of these for whatever size forearm your client has, bigger and smaller. Something else is there, if your client does not have good wrist control, you could like have something that bumps out right here just to keep their wrist flat and stable. There's something you can put behind the elbow, so if you're going up and down, their elbow can stay back and in a good position. One last thing is this will not move, it's set in its place, but if you screw this screw out, the client will be able to freely move their arm up and down just with extra mobility if they're at that point. Yeah.
Okay. Hi, everyone.
Okay, and then some evidence that we found, an article by Atkins et al. In 2008, studied 18 occupational therapists These OTs took a survey answering numerous questions on the mobile arm support and their experience in implementing it with clients. Side note here is that these were experienced OTs who had often incorporated the mobile arm support into therapy sessions. The article found that 92% of the therapists would prescribe the mobile arm support to clients with weak upper extremities, but high motivation levels. This was the most frequent task the mobile arm support was used for was with feeding. And then something else to note was that all participants in the study were able to independently perform a task that they otherwise would not have been able to.
Okay, so here are our clinical reasoning questions. Our first question was, what is OT's role in addressing feeding? How does not being independent in feeding impact a child? What is the best way to position a client when engaging in a feeding intervention? And what are other environmental adaptations that could be made to increase independence with feeding? Okay, and here are our references. Thank you for listening.